Main causes of chest pain are heart problems, lung problems, your guts, muscular problems and the main chest muscles, your pec muscles, or it could be infections of the skin. So let's have a look at each of these and the main characteristics of those pains. So, number one, everyone worries about chest pain, maybe it's your heart. Typical heart pain is a sudden onset of a pain around the front of the chest. It's quite diffusely spread all over the show. It's usually quite severe. It goes sometimes onto the inside of your arms or up in your neck or in your jaw. And the thing about heart pain is often you feel very tired and sick. That's typical heart pain. The second one, major cause of chest pain is lung problems. Now the typical pain that's caused by lung disease is a sharp pain. The nerve fibres are on the outside of the lung and the inside of the chest wall. So if the lung gets infected or pops, as in what's called a pneumothorax, usually there's a sharp pain, and it's worse with deep breathing. When you take a deep breath, the inflamed lung rubs against the inside of the chest wall and it hurts more. If you don't breathe, it doesn't seem to hurt. So lung problems present with a sharp pain that is generally worse with deep breathing. The third cause that's most common in my experience as a GP is problems in your guts or in your gullet, your esophagus. If you get acid reflux or ulcers in your tummy, it can cause upper chest pain. It doesn't have to be in your stomach. You can feel low, sort of dull ache, and there can be a bit of reflux of acid as well. So remember that. Ulcers, tummy ulcers. The fourth one that we can think of is inflammation of the muscles of your chest. Like you might pull a muscle in your main pecs, pec major, or at the back here, and that pulled muscle can actually give you quite a bit of pain. Generally though, it's tender in the chest wall over the area of the inflamed muscle, and if you stretch the muscle, it hurts. So generally muscular types of problem that give chest pain are pretty easy to pick up because you can feel the pain and take a deep breath or move and it hurts. The fifth common cause is actually initially hard to pick up. This is a sneaky little bastard. It's things like shingles, which I talked about a few weeks ago. What can happen is you get the chickenpox virus affecting the nerve, but there's no blisters for a few days. So you get this pain coming around over your heart and you think, oh my God, I'm getting a heart attack or I've got lung disease. And it's very hard to know what's going on. Then suddenly the little blisters form and you know it's shingles. So skin infections can be a cause. Lastly is a common cause of chest pain is actually just anxiety. You get uptight, you can get headaches with anxiety, but you can also get chest pain. But that's a diagnosis of exclusion. If you get significant chest pain, you should go and get your doctor to check it out or the local A&E clinic, because it could be something more serious.